There are three sets of trigger points in the pectoralis major muscle, and they correspond to the three divisions of the muscle that we discussed before. The first set are in the clavicular branch, and they will give pain in the front of the shoulder. The second group is in the sternal division, so this is attaching to the breastbone, and there are actually two separate pain distributions. The first is just local over the chest, and the second is over the chest and down the inside of the arm. This is the typical pain that you would find in heart-related pain, so angina or pain arising from a heart attack, a myocardial infarction, often gives pain in this kind of distribution. I think at this point I will just discuss, as a disclaimer, it is really important that if you feel pain across the front of your chest, which may or may not radiate down the inside of your arm, you need to first rule out whether this is actually coming from your heart. Therefore, you should go and see a competent medical practitioner, a cardiologist, and have whatever tests you need to have, which may include a cardiogram and may go all the way through to an cardiac angiogram to make sure that you do not have pain of cardiac origin. Once you've ruled this out, then you can go ahead and treat the trigger points. I say this also because there is something called a viscerosomatic reflex, which occurs with the pectoralis major muscle. And that is that sometimes there's an interaction between pain arising from the organs and pain arising in the muscles and the tendons overlying the organs. So it is recognized that if you have say you have angina, which is pain arising from your heart, and you feel it over this area, if you treat the pectoral trigger point, sometimes that will actually reduce or even abolish the pain coming from your heart. What's very important here is it is not treating the underlying cause, you are just treating a reflex that occurs in the body. Therefore, you need to have sorted out properly that there is nothing occurring in the coronary arteries before you go ahead and just focus on treating the muscle itself. There is another very interesting somatovisceral reflex which occurs with this trigger point here. And this trigger point, not on the left side but on the right side, overlying the 5th and 6th ribs, this is associated with certain types of cardiac or heart arrhythmias. So it's again recognized in the literature that people who have a particular type of rapid heartbeat called a supraventricular tachycardia, that treating the trigger may in fact improve the heart arrhythmia. There is one more trigger point which is in the free edge of the muscle, and that arises from the costal portion of the pectoralis major. And when this trigger point is activated, you feel pain running across just the lower part of your chest, and in women this corresponds to pain felt deep within your breast. Breast pain is also obviously a symptom that is not to be ignored, but this, if for women, if you feel pain in your breast and you have this sorted out by a physician who is competent in this area, a breast physician or a breast surgeon, you have mammograms done to make sure that you've ruled out underlying carcinoma of the breast, then treating this particular trigger will turn off your extremely worrying breast pain.